This is a very common question nowadays, and it's something that is very dear to not only mothers, babies, their family, but also to governments as well. I think before you think of reducing a cesarean section rate, you've got to establish exactly what it is, what the reasons are, why they're being done, and whether it's high, if you like, or low. There are several different groups of women, first-time mothers, second-time mothers, mothers have had previous scars. There's women with very different background of emotional experiences. We've got to take all of this into account. And if you have a classification system, like the 10-group classification system, you can look into the detail and decide whether your cesarean section rate is too low, too high, or okay. But it depends not only about cesarean section rate, it depends on how the babies do, how the mothers do, how they perceive their care as well. But when you have that information, yes, there is undoubtedly some units that could possibly reduce the cesarean section rate in certain groups of women. But indeed, on the other extreme, there are parts, hospitals and indeed parts of the world that possibly the cesarean section rate has to be done because there's no access to cesarean section. So it's a multifaceted problem, but it starts with knowing, like any good organization, knowing why you do cesarean sections, how often, and what are the sequelae.